I'm here with my dear friend and patient of a long time now, Patti, a big believer in foundation training and somebody that's used the work for many years now to battle some pretty chronic pains and continue surfing and continue living a wonderful life, which is clearly the goal. We want to show you just a simple, really simple protocol to help you get through sciatic type pains. Pains from the external rotation of the hip and the tightened muscles of the hip joint, putting pressure on one of the largest nerve channels in the body and creating a series of different, sometimes lifelong types of agonies. First and foremost, Patti, just lay flat, go loose for a second. This is laying flat. I don't want you to really get that good at this. I want you to get great, however, at bending the knees just a little bit, separating the heels maybe 6 to 8 inches. There we go, because we want a lot of internal rotation at the hip joint from this. You're going to touch the big toes together and spread your toes big. There we go, make the foot active. You'll notice that Patti's knees are not bent at 90 degrees. They're quite more obtuse than that. They're broader. We don't want a 90-degree angle. We want a longer angle at the knees. The knees are squeezing together, but the knees are squeezing together because the hip joints are rotating inwards towards center. The parts of her body that are on the ground are the tailbone, the middle of her rib cage, and the neck and head. The heels start to press towards her butt just a little bit, and she's going to squeeze the knees in like a little pulley, but there's no movement, it's just isometric. You're going to take the arms right up above your chest, and you'll see all of her fingers are touching as if she has a giant grapefruit in her hand that's just pushing it just so far apart that she has to squeeze together. The elbows squeeze together just a little bit, but they don't move. This is all isometric. Imagine how strong you're pushing. The breath pattern from here is in through the nose for 5 or 6 seconds, and you're expanding the rib cage, particularly the back of the rib cage. While you're doing this, reach for the mat. Every time you inhale, think of your ribs, not the spine in the middle of the ribs, but the outer edges reaching for the mat below. And see how that widens the rib cage and actually activates the abdomen a bit more than you're used to. Squeeze the knees together from the hip joints. Dorsiflex the ankles, meaning pull the toes and the front of the foot towards your shins, but don't separate the knees. Take 2 more deep breaths, 5 or 6 seconds in through the nose, maybe 6 or 7 or 8 seconds out through the nose if you can. Focus on widening the back of the rib cage. Focus on lengthening the back of the neck, pulling the top of the head away from the base of the shoulders. 1 more breath in, and rest completely. That active position is called a basic supine decompression. We're going to take that a little further. It should feel when you're doing this like the middle of the legs is being activated more than the outside of the legs, and it should absolutely feel like you're not squeezing your butt muscles together, clinching really hard. It's quite the opposite. We're rotating the hips inward to relax the glute tissue and allow it to get longer, so the next time you need it, it's more available. Go right back into that same position. The knees are bent. That angle is greater than 90 degrees. The ankles are dorsiflexed, and let's widen those heels just a little bit more. We want internal rotation from the hip joints traveling down into the arches. This is a corrective exercise for external rotation that leads to sciatic pain. The knees are touching, the hips are rotated in, the toes are touching, the heels are separated. Expand the back of the rib cage and the front of the rib cage like an umbrella opening, all sides open. Take the base of the skull and pull it away from the shoulders until the front neck muscles are engaged, lengthening your neck. Before we do anything else, 1 big deep breath. In through the nose, expand the torso, lengthen the torso as you breathe. As you exhale, tighten the torso, but keep the length. Bring the arms right up over the chest. Now, here's where you get an option. You can stay here, you can squeeze the knees, you can do whatever you want. If this is a hard position, it's probably a good thing to do. If you can advance it 50% or 40% from where you are, squeeze the heels towards your butt, squeeze the knees, and allow your butt to begin to hover about 1 inch, that's all, 1 inch above the ground, and feel the heavy activation and muscle contraction from the hips down, the medial hamstrings, the back of the legs, the adductor muscles on the inside of the thighs. Let it shake and tremble and be challenging for just another breath or 2. Big rib cage, strong anchored legs. Let yourself come back down. Nice. I want to give you this protocol not as something that's going to fix you today. If it does, hey, that's awesome. I love that. But I want you to develop the skills that we present to you in foundation training. And there's a lot of other very useful systems out there that I want you to understand as well. There's so much you can research into. But my only place of expertise is foundation training, and this and the other protocols I put out there are basic skills you should be developing on a daily or close to daily basis, 5-10 minutes a day. Do your best to make this stuff help you feel well, and it's a lifelong skill of feeling better. I hope it helps you.